Hi and welcome to session 3 to revise for Unit 1, Promoting Health and Wellbeing for AS, Health and Social Care and Childcare. The date of the examination this year is Thursday the 16th of May. Today's session will look at the different legislations and strategies to promote health, wellbeing and resilience. We will be looking at some examination questions then based on these legislations and strategies, and obviously looking at the main parts of each one that's on the specification. So to begin with tonight, we will look at the main aim of each different act or legislation. So the first act that we will look at tonight is the Social Services and Wellbeing Act. The main purpose of this act is to improve the well-being of individuals and carers who need care to ensure that they get support through collaboration. So if we look at the information that's been given to us in the specification by WJC, obviously this is the first point, the first bullet point there. It looks at obviously different rights and entitlements that individuals have. It would look at how empowering individuals to have a new relationship with health and social care and childcare services will obviously improve their well-being, and also empowering them, those who deliver health and social care and childcare, to co-produce solutions with individuals. Obviously, this emphasises then that individuals should be empowered to develop a new relationship, and I think gain a better understanding of the service users in order then to make sure that we're addressing the points that are most important to them. Now, the Act is based on 5 key principles. Okay, so these are obviously demonstrated here in the slide. It looks at voice and control, how prevention and early intervention can obviously improve someone's well-being, well-being being the third factor, co-production, and then multi-agency. So again, in the top left-hand corner, you can see then the 5 principles being VPWCM. Okay, now what we're going to do tonight is look at each of those 5 key principles in a little bit more detailed for you to gain a better understanding on how actually this is implemented through the Act. Okay. So like I said, voice and control is the first key principle. So what this means really is that we're putting an individual and their needs at the heart of their care. And we're giving them a voice and therefore control in order to achieve the results that will help them ensure well-being. So this can be as basic as ensuring that we are listening to what one chooses, and then obviously giving them control of what they feel is most important to them. Okay, so this could be somebody, for example, using their voice to make sure that they have a safe and permanent home. It could be perhaps taking part in activities that they perhaps have never been given a decision about before. It could be perhaps that they feel a little bit lost because they've lost their independence in being able to plan and cook a meal. And if we address this issue, this would make them feel far happier. And obviously, if possible, they can remain or become part of their own communities through things that they choose themselves. And because they've used their voice and obviously we've listened to what they would choose, this then helps them feel a little bit more in control. Okay. So as the image shows you, a strong voice and greater control over support in what matters to me. Okay, so the person then is at the centre of the decision making. If they've not attended meetings previously, this is something that the Act wants to improve on in the future. Okay, the second key principle then is prevention and early intervention. So, can we foresee problems and therefore intervene early enough before that problem escalates? Okay, so being able to access advice and support early to maintain a good standard of living and reduce or delay the need for long-term care and support. So if we look then at how or examples of this is maybe a local authority discovers that part of its population lives in poverty, and then that authority then dealing with these factors that cause the poverty in order to improve the outcomes for the individuals. So this, for example, then could lead to less problems in terms of homelessness, less dependency on perhaps alcohol and drug use, less antisocial behaviour, less mental health worries. So obviously it's very hard for all local authorities to completely make every aspect of poverty disappear, but even if we can make a small difference to these individuals, obviously then there will be less stress, you could say, on the NHS, because of these issues being dealt with earlier rather than later. The W then is well-being. Okay, so helping to ensure that people are happy in all areas of their lives. Okay, so not just one aspect, but all areas of their lives. Now, the image that's just appeared on your screen obviously gives several examples of well-being, this being safe, that I have somewhere suitable to live, that's warm, that it's not perhaps in an area where there's a lot of crime. I don't suffer perhaps from a damp house, and obviously I have the correct resources for the individuals living in that home. I can be involved in the decision making that impacts my life. So this is going back really to the voice and control aspect as well. Obviously, if the voice and control is something that is emphasized on, then this of course is going to help my well-being, because I'm going to be satisfied, I'm going to be doing activities that I enjoy, I'm going to perhaps cooperate a little bit better, I'm going to have a better relationship with my care workers, etc. I also have friends and I feel part of a strong community. So again, if I was to engage with activities, this would give me a better connection with my community. I can have every chance to do well in education, regardless of whether I am suffering from poverty, what my ethnic background is, and so forth. I can feel good about my life and I can feel good about what's ahead of me. I can begin to thrive. I can begin to be ambitious with my plans and have clear goals and objectives. I'm able to work, okay, and obviously have support to seek work if that's a problem. And obviously then for children to be able to grow up happy and successful and to be well looked after, okay. So here are several examples on what well-being could look like to certain individuals. The C then is for co-production. So are the people who are involved in the planning and delivery of the support and services able to recognise their own knowledge and expertise and obviously utilise them to the best possible outcomes? Okay, so if we looked here at examples, can we work together with obviously the family, friends and carers to ensure that somebody's well-being can be fulfilled as quickly as possible? And rather than perhaps assume that somebody else is taking responsibility for a certain aspect of care, can we ensure that we've got effective communication and ensure then that obviously we're doing everything that we can possibly do to ensure that that person receives support from every possible direction? Then, okay, this being multi-agency, so obviously we are aware that different agencies and partnerships and organisations are perhaps helping an individual. With multi-agency, we need to make sure that there's a strong partnership and working relationship between all involved. Therefore, can we ensure that, again, we have effective communication? Can we ensure that each and every partnership, agency or organisation is fulfilling their aims? Okay, now here we have an example of different agencies. So if we looked at education, community services, emergency services, housing, voluntary sector, the health organisation and the probation services, are we all fulfilling our role as well as possible to ensure then that this individual is cared for to the full capacity? Okay. Now, WJEC have released a document for us to help us with our revision. Obviously, on the left-hand side here, you can see the 5 main factors or core principles of the Act, okay? And then obviously on the right-hand side here, we have some information in terms of what is well-being to a person, what is well-being to a child, and what is well-being to an adult. Okay, so depending on how the question is asked, obviously we can then bring in these 5 key principles based on either a person, a child, or an adult. Okay. So this is how an examination question can appear. Okay, so describe the core values of the Social Services and Wellbeing Act. Okay, so there is nothing wrong with you here in talking about obviously the 5 key principles. Okay, now the question doesn't specifically state whether this is for a person, whether it's for a child or an adult. Okay, so we could obviously give a variety then of examples on these core values. So with voice and control, do I have a good voice and control of my everyday life? Can I participate in work? Do I feel that I can contribute to society? Am I making decisions that people are listening to? And then hopefully things changing based on those decisions. Can we intervene early to prevent certain situations from getting worse? So for example, getting support immediately, and then obviously this prevents needs from increasing. If we looked at our well-being, then we could look at am I able to go to school? Am I involved with training to further or upskill myself? Can I attend different activities that will make me feel happy and complete? If we looked at the co-production then, that I'm having information and advice from all directions. We are including suitable relationships in terms of family, friends, to co-produce together to improve somebody's outlook on life. And then obviously with the multi-agency, can we communicate and take responsibilities of their role in improving an individual's life? And then this would hopefully avoid then duplicating any services in the future. Okay. So the next act or legislation that we will look at tonight is the Wellbeing of Future Generations Act. Okay, so on the right-hand side here, what you can see is what is delivered to us from WJEC. Okay, so obviously here we have 7 goals that's listed in the Act, and then there are 5 ways of achieving this Act. These goals that are based in the Act. Okay, so in general, what this Act is looking at doing is involving and improving the social, economic, environmental and cultural well-being of Wales. So can we make Wales a better place for our future generation by looking at these different aspects? Obviously thinking about the long-term effect of every decision that we make at the present moment, working with people in communities who can identify perhaps areas of concern so that we are improving things that are important to the citizens within Wales. We're trying to prevent problems and then adopt a more coherent approach to make Wales a thriving country, and obviously help create the Wales we all want to live in now and in the future, a safe and attractive place to live. Okay, so what I'm going to do now, we're going to look at each of the 7 goals in terms of what exactly do they mean, and then we will look at the 5 ways we can obviously achieve these goals. So if we look at the 5 ways of doing this, okay, here I've got a code for you of LIIPC, okay. So the 5 ways are look in terms of the long-term effect. Can we integrate and involve the correct people to then hopefully prevent, and then obviously this needs to work within collaboration. So again, what I will do on the next slide then is go through each of the 5 ways with you to ensure that you have examples of this. The 7 aims then of the Wellbeing of Future Generations Act is Wales prosperous, healthy? Can we have a culture and language that's flourishing? Do we have cohesive communities? Are we resilient? Can we be responsible on a global level? And is Wales an equal place to live? Okay, so again, what I will do with the 7 aims in 2 slides then is make sure that you understand what exactly they mean and how this could happen. So here are the 5 ways to work towards the 7 goals. Okay, so long term, can we think about the long-term impact of what is being done now to ensure that our future is successful and we do not fail to meet the future generations' needs? Can we work in an integrated way? So the other wellbeing goals need to be considered in terms of how they influence and are influenced by this particular goal. Okay. Can we involve a variety of people from different fields with decision making to ensure that we're making the correct decisions? Can we then prevent, so understand why these problems are arising in the first place, and then hopefully being able to prevent it from happening in the future? And as I've said before, can we work together in collaboration with the individuals, carers and organisations to ensure that we have a positive impact now and on future generations? So for example, if we looked at the problem with child obesity, can we work in collaboration with the actual children, the schools, families and obviously health services to try and take control of these problems, so in the future that they're not still lingering with us. Okay, so the 7 aims then of the target, of the Act, is to make sure that we in Wales are living in a prosperous Wales. So that is Wales is thriving, that is Wales is productive in terms of its society, and that we're also innovative. Can we look at Wales in terms of health? So I've spoken before about childhood obesity. What about understanding choices and behaviours that are beneficial to us? So for example, drinking within the guidelines, not smoking, exercising. These obviously would help us be a healthier Wales in the future. Then if we looked at our culture that's thriving, okay, do we take pride in our heritage and the Welsh language? Are we encouraging people to take part in sports, arts and leisure and things that have been part of our heritage for such a long time? Can we work cohesively then together Are we attractive in terms of our communities and what we have to offer? And obviously people take pride and respect what we have locally. And do we have the correct information and resources that's appropriate to our ageing generation and also our younger citizens coming through? Can we support social resilience? Okay, so yes, we're all going to face adversity, but can we be more resilient and proactive in looking at these problems that we are faced with? And do we have the ability to adapt to change? And this perhaps is something that we need to work on. And then obviously what we would like then is that we are responsible on a global level and taking responsibility of our decisions to ensure that we put Wales on the map, and obviously we make a positive contribution to international well-being. So again, these are the 7 aims of the Act. Okay. And of course, sorry, the last one, can we make Wales a more equal place? So can we have a fair chance to all individuals, no matter what their background? Okay, so here we have an examination question. So the Wellbeing of Future Generations Act is an example of a legislation designed specifically for Wales. Describe the main principles of the Wellbeing of Future Generations Act 2015. Okay, so obviously the 7 key principles then is something that you could pick up on, okay? And obviously these are being prosperous, where everyone has a job and there's no poverty, and we live in a lucrative Wales. We live in a Wales that we would be happy and comfortable in. We are healthier. We're making decisions that obviously will impact our health in a positive way. Perhaps we're making better use of our GP surgeries. We're taking more control of the decisions that we make that can contribute towards positive health. We are identifying strong links with our culture. We're using language which is flourishing, and that we have more opportunity to do different things and also receive care through the medium of Welsh. We can look at cohesive communities. So we live in happier places, we get along together, there's less crime, there's less antisocial behaviour. And we have more resilience in terms of when problems occur, that we can adapt to these problems, for example, flooding and the pandemic. We can take responsibility of the environment and we think about other people around the world rather than ourselves. And there we have an equal Wales where people feel respected regardless of their background. Okay. So next we will look at the prudent healthcare. So obviously on the right hand side here is the specification from WJC. So we have 4 bullet points here in terms of what the principles are of the prudent healthcare are. So these are achieving health and well-being with the public, patients and professionals as equal partners. Care for those with the greatest health need first. Do only what is necessary and no more or no less. And then reduce inappropriate variations using evidence-based practices consistently and transparently. Okay, so the obvious aims then of prudent healthcare is to shape the NHS to ensure that it adds value and contributes to better outcomes and is sustainable. Okay, obviously we are faced with many healthcare challenges such as poverty, obesity amongst children and adults, and how are we going to go about these then in terms of facing these challenges and making an improvement? So the principles, okay, of the prudent healthcare then would like to focus all action based on 3 main areas. Okay, so the first area that we look at now is that people, as in public users, service users of services, okay, and there are too many people at the moment who are given tests, treatments and medicines, and with some individuals, there's no clinical benefit. Okay, so it's not doing much good, and obviously can lead to then further psychological or physical harm. Okay, so can we possibly reduce any unnecessary, inappropriate tests, and then making sure that individuals are given informed decisions about the care that they receive? Why? Okay, because each year the model or the use of outpatients is increasing. So if we looked at the NHS, they provided 3.1 million outpatients appointments in Wales. Okay, that's more than the population of Wales, obviously, and a third of these were linked to just 3 specialist departments, being trauma and orthopaedic, ophthalmology and general surgery. Okay, so can we change this model, and can we make sure that it's accessible for individuals to get specialist advice in primary care settings, and making these perhaps appointments more readily available closer to the individual who obviously needs to use the service? And then the third main area then being that the services must use the staff that they have and with the appropriate skills to provide the best care possible at the right time and the right place for that individual. Okay, so can we get a better partnership and integration to ensure that the public services work together to improve the healthcare? Okay, so this involves enabling and empowering 3 main groups of people. Okay, so if we looked at the public, the Prudent Healthcare Act obviously is looking at the individual or the public making choices from day to day in terms of things that can affect our health and well-being. And we need to take more responsibility ourselves to do our little bit, which will obviously help then the healthcare sector, for example. Okay, so can we make the choices from day to day in terms of what we eat, what we drink, whether we smoke, whether we take substances, whether we exercise, to ensure that this will have a positive impact on our long-term health and well-being, and maybe take more responsibility for these decisions and be accountable for these decisions. Obviously, then we can look at professionals. So we need to be more open, okay, perhaps as professionals, and treat patients as partners and experts in their own lives. So this can come down to, again, making sure that we listen to what the individual is saying to us, and then make our decisions based on what their input as well. Okay, so the public is to be involved in the decisions about their own care, and obviously then take more responsibility alongside the professional. And can we ensure that we properly listen to our patients and the wider community to ensure that we are delivering what is needed at the right time, so that we spend our resources effectively and wisely within the NHS. Okay, so this means that we look on the value and outcomes of our decisions. So this then obviously ensures that there's co-production, so the public, patients and professionals are equal partners as each other, and this will help then recognise the factors to promote health, positive health. We're looking at who needs this treatment in terms of who are the individuals with the greatest health needs, and to prioritise those individuals and make them perhaps the priority in terms of they're at the top of our pile, and we need to ensure that we're making the best use of all the skills and resources to help those individuals at greater health needs first. Now, this may sound a little bit harsh, but can we do only what is needed? No more, no less, and do no harm. Okay, so this encourages patients and those who provide them to pause and think, is this this type of healthcare really helping? Is it possible to consider other alternatives and avoid then wasting resources unnecessarily? So we're putting safety first, we're avoiding injuries, we're avoiding mistakes, and we're avoiding duplications just by doing what is needed only. And then are we acting on evidence? Okay, so we can reduce inappropriate variations through consistent and transparent use of evidence-based practice. So is it working? Is it successful? If it is, great, let's continue with it. If it's not, then it needs to be revised. Okay. Again, we've had a student hand out here in terms of an organisation material that gives you obviously the information on the prudent healthcare. We have then the 3 types of actions that this is based on, and a little bit more information on the left hand side then in terms of the 5 main principles of it. Okay, so an exam question, outline 3 principles of the prudent healthcare strategy. Okay, so obviously here you could say that we're ensuring health and well-being by working with the public, the patients and professionals, and making sure that they are equal partners throughout the process. Prioritising those with the greatest needs first, and then making effective use of the skills that we have and the resources that we have. If we do what is only needed to, obviously we're reducing duplication of services, and we're ensuring then that the healthcare is benefiting by using time and resources effectively. We can look at services need to provide the best possible care by using or utilising the limited financial resources available. Okay, so can we make sure that we're spending the money appropriately? And then obviously reduce inappropriate variations, and we're basing this on the evidence. So like I said, if it's working, great, let's continue with it. If it's not working, then it needs to be revised to ensure then that the best methods are being used. Okay, so we will now look at a healthier Wales. So a healthier Wales being sets out a long-term future for the whole system approach to the health and social care, and then obviously the health, well-being and preventing any illnesses. Now, if we looked at the 4 main goals of a healthier Wales, we can see that we need to be ensuring that people are happier and healthier. We need to make sure that our services are exceptional and that we're using the most latest technology. We're looking at health and social care services are easier for people to use, and also that staff are motivated and feel that they are being used effectively within the service. Okay, so there are 10 key principles. Okay, and what I'm going to do briefly with you now is look at the 10 key principles. So the first one is evidence-based. Are we using research and knowledge to understand what works, learn by working with others? Can we transform, so ensuring that new ways of working are affordable and sustainable? Do we have independence then? So we're helping people manage their health and well-being by being strong and independent about what they're doing in their homes and local areas, and then hopefully speeding up the recovery process. Are we ensuring better results, better value and experience for people at lower costs? So what this means then is what matters to us, and then we deliver what is necessary for the person at the right time. Are we taking personal consideration towards the health and care services that are tailored to the needs and preferences to that individual? So, for example, how old they are, what their preferred language is, where do they live, who would they like involved with the decision process? So this is a personal care process. Can we prevent and intervene early? Okay, so take action to enable and encourage good health and well-being. So this is perhaps something that individuals can participate with, as well as different authorities. Can we safeguard, so enable people to live safely with their families and the communities? So we perhaps reducing levels of crime, reducing antisocial behaviour, the use of alcohol, the drugs, and we're living in a safer community. Seamless, so this means a less complex and better coordinated service and information for the individuals, so that we avoid transfers between service which could create uncertainty for the individuals. So for example, if somebody is returning home after a period of stay in hospital, that the services are clear on, for example, whether they need home care after returning home from hospital. Can we ensure that we develop good practice from local level to regional and national level, and that all teams and organisations are collaboratively working together? And do we have then a voice which obviously empowers individuals with information, and they are given the support and care that's needed to manage their own health? Okay, so the last aspect that we will look on tonight are more than just words. Okay, so this is to ensure that Welsh speakers should not need to request a service in Welsh, but that the service should already be provided in that language. Okay, so we're looking at the rights and needs of Welsh speakers to ensure their health, well-being and resilience is as good as possible. Okay, we've had obviously scenarios in the past where perhaps individuals would go to a hospital and would want to speak Welsh, however there's no one in the hospital that can speak Welsh, and obviously this then will hinder the communication and the messages that need to be delivered from the service user to the professionals and vice versa. Obviously, the Welsh Government have a strategy where they're trying to increase the numbers of Welsh speakers, and this obviously would have a major impact on the health and social care sector, and it would contribute hugely to the workplace, and ensuring then obviously we have more Welsh speakers working. So why? To ensure that individuals can communicate in their own language. This will ensure dignity and respect, and also ensure an individual's identity and human rights are promoted. Sometimes we obviously have to translate how we feel, and the context of this message can not be received as clear. So here, under challenging circumstances where perhaps someone's feeling quite vulnerable, quite frail, quite scared, they can obviously then communicate their needs in a far better way. So being able to communicate in Welsh is central to somebody's identity. This shouldn't be used as something extra or optional. Okay, instead it should be an essential part of the services that's being provided. Obviously there's less risk of causing distress to the individual, and it improves the communication, which then will help the personal outcomes and the professional relationship that's established between the service user and worker. And obviously this is just ensuring rights of the individuals. Okay, so what you could look at here is how. Okay, it's not as simple as just get a Welsh speaking individual into the care sector. Looking at translating perhaps menus, especially perhaps for somebody who is in a care home. Can we have signs placed within hospitals that are obviously in both languages? Can we have service users being greeted with the Welsh terminology if that person isn't fluent in Welsh? Can we have activities based within Welsh? Can we have maybe television programmes in a care home or in a waiting area through the medium of Welsh? Can we be playing Welsh music so that individual feels connected and proud to be able to use that language? Obviously there are many benefits of using the Welsh language in terms of making somebody feel more at ease. They can obviously communicate their needs more appropriately. They don't have to worry about situation. They feel less stress. They make better connection with that individual and can ensure a better relationship with them. So you might be asked here, not in terms of exactly what is it, but how could this happen? Okay. And obviously for somebody who was only able to speak English, this could be quite hard. But from somebody perhaps who can speak Welsh, there are many, many ways that this can be promoted throughout different health and social care environments. Okay. So if we look back at the criteria of today's session in terms of the aims, okay, we obviously looked at the Social Services and Wellbeing Act. We then looked at the Wellbeing of Future Generations Act. We then looked at prudent healthcare. And then after prudent healthcare, we looked at a healthier Wales. And then after a healthier Wales, we looked at more than just words. So there were 5 key areas from this session. I'm hoping I've given you an insight into them, and obviously you've had a chance to look at an examination question. There are plenty of resources available to you to obviously enhance your understanding. There is a 4th session going to be posted very soon. Thank you very much.